In dentistry, inlays, crowns, and onlays are three different types of dental restorations used to repair damaged or decayed teeth. Each of these restorations serves a specific purpose and has distinct characteristics. Here's a breakdown of the differences between inlays, crowns, and onlays. Inlays. Inlays are conservative dental restorations used to repair small to moderately sized areas of tooth decay or damage. They are typically made of materials like porcelain, composite resin, or gold. Inlays are custom fabricated in a dental laboratory and then bonded to the prepared area of the tooth. They fit within the cusps, raised points, of the tooth and are used when the damage or decay does not extend to the tooth's cusps. Inlays are suitable for repairing the chewing surfaces of molars and premolars. Crowns. Dental crowns, also known as caps, cover the entire visible portion of a tooth above the gum line. They are used when a tooth is severely damaged, has a large cavity, or has undergone root canal therapy. Crowns can be made from various materials, including porcelain fused to metal, such as gold or stainless steel, and all ceramic options. The tooth is prepared by removing a significant portion of its outer structure to accommodate the crown. Crowns provide strength and protection to the tooth, restoring its appearance and function. Onlays. Onlays are sometimes referred to as partial crowns or three-quarter crowns. They are used when the tooth's damage or decay is too extensive for an inlay but not severe enough to warrant a full crown. Onlays cover a larger portion of the tooth than inlays but are more conservative than crowns. Like inlays, onlays are custom-made and bonded to the tooth surface. They can be made from materials similar to those used for inlays and crowns, such as porcelain or composite resin. Onlays are a suitable option for repairing teeth with damage that extends beyond the cusps but doesn't require a full crown. In summary, the main differences between inlays, crowns, and onlays lie in the extent of tooth coverage and the types of dental issues they are used to address. Inlays are the most conservative and cover the least amount of tooth structure. Crowns cover the entire tooth, and onlays provide a middle ground between the two, covering a significant portion of the tooth surface while preserving more natural tooth structure. The choice of which restoration to use depends on the extent of the tooth damage or decay and the patient's specific dental needs. Your dentist will assess your situation and recommend the most appropriate treatment.